Hello, everyone. Welcome, welcome, welcome. Hello. Hi, everyone. Welcome to Q&A with Dr. Mercy. Let me see if anyone's coming in. Hello. Hi. All right. I'm seeing people coming in. Hello. Welcome to the live. This is Q&A with Dr. Mercy. Happy end of the week. I hope you guys are enjoying yourselves where you're at. For me, I traveled last week. I was actually at a medical conference, and it was a very good conference. It was actually a wellness conference, and so I have a lot to share about that conference because I want to incorporate more about prevention. As we all know, prevention is better than cure. So um, I'm just excited, and some of our coming lives will be dealing with how to prevent from having an actual medical condition. Hi everyone. Hi. Hello. Hello. I'm just seeing all the hellos, and so uh, Cherry Baby Byron. Yes. What is this all about? Well, good that you asked. November is Men's Health Awareness Month. And I know this is BWE, which is Black Women Empowerment, but we should take some time to also talk about the men. So since November is Men Health Awareness Month, I wanted to talk about, what men should know about when it comes to their health from a doctor's perspective. And so I wanted to use this live to talk about that. Hello, Adrian. How are you? Good evening. How are you, Miss Rose? Good evening. Hello. And Jacqueline, how are you? Hi. So where are you guys all viewing from? What city, what state, what country? Let me know in the chat. I'm here in Texas, and man, it is cold. It's colder than Florida. I just came back from Florida, and I was wearing shorts over there, but over here, I'm like, yeah, gotta pull in the sweater now. Oh, Canada. Okay, okay. It's colder over there than here. I shouldn't be complaining, but that's okay. Oh, welcome, Cherry Baby. Good evening, LinkedIn user. North Carolina. Awesome. Joni, thanks. So, yeah, I bet it is very cold in Toronto. I bet you guys have even snow by this time. Belize. Oh, okay. LA, Jacqueline. Connecticut, Bloomfield, Connecticut. Nice. Tennessee, Elmont, New York. Orangeburg, South Carolina. It's colder than usual. I know it has been very cold this season. Normally in Texas, it doesn't get cold until maybe after Christmas. Even during the week of Christmas, you still kind of have a little bit of fall, but it has been getting a lot colder this year. So I'm hearing Clinton, Utah. Oh, nice, nice. And Sharon, you're from Texas. Okay. Tabitha here in chilling Detroit. I bet you. I bet you. So I know I can't complain because I've been seeing on CNN that some people already have snow. So, but I guess I've been spoiled with warm weather. I guess. But anyways, let's get started. Again, like I said, November is Men Health Awareness Month. So I decided to take this particular live just to talk about what are some screening tests or some things that men should think about to have optimal health. We always talk about diseases. Once you have the disease, what sort of prescriptions you should use or what sort of tests you should use to diagnose the disease. Why don't we talk about tests to keep us healthy, tests to see what our our overall health is, so we can prevent either a very chronic disease from occurring, or we can also catch it and nip it in the butt in its early stages. Oh, okay. So there's no snow in Stafford, Virginia. Surprising, but extremely cold, I bet. So let's just go ahead and dive right in. I did a PowerPoint presentation with this, so I'm gonna go ahead and get into my slides, and we can talk about that. So with men health awareness, I'm going to start at the youngest age. So when they're still teens, at the age of 15, the first thing, I guess, pre-adolescents or adolescents should do is they should start checking their testicular self-exams. And I think it's Spectra Testicular Self-Exams, Testicular Skin Monthly. So I wrote that, and it looks like it's a little bit of an error, but it really should say inspect your testicular self-exam. So why should they inspect it? Well, they found that within that range, that's when certain tumors, testicular tumors, or even cancers may appear. So if you can start checking, and just like how women, we check for our breast cancer with our breasts, for men it's the testes. So what they want you to do is hold your both thumb and your first index so you do that, and just start just feeling the testicles and see if there's any abnormal bumps or and pain. And if there is, definitely start talking to your doctor about that. So that is important as a man. Also, if you guys have any questions, I forgot to say it. Well, first of all, please like this video and share it for all men, because it's important for them to know what things they should look for as they get older. But also, if you have any questions, make sure to jot them down in the comment section, and we'll discuss it. This is supposed to be a discussion so we can all be more aware of our health. Knowledge is power and knowledge is key. So by age 18, studies have shown, and doctors typically recommend, you should at least check your blood pressure one time. Why? Well, they've observed, especially because of the obesity epidemic, meaning a lot more people are getting more overweight, more obese, that there is higher chances of these, I guess, young adults having high blood pressure in their early years. So if you haven't had a blood pressure check by the age of 18, doctors recommend just go ahead and get your blood pressure checked. And you don't necessarily have to buy a blood pressure machine, although they do have them in the drugstore. They also, if you do recall, especially like in stores like Walmart or sometimes CVS or Walgreens, they have those stationary blood pressure machines where you can put your arm in there and it automatically takes the blood pressure for you. So if you can do it that way, and then obviously you can go to your doctor's office, and majority of the time during your visit or an annual screening, they will check your blood pressure. And so just in case you're not aware, normal blood pressure typically is less than 120 over 80. So it's a two number system. The top number, they call it the diastolic blood pressure, and the systolic blood pressure, and the bottom number, they call it the diastolic blood pressure. Okay, so the systolic blood pressure is the 120, and typically that's good. That's good. We definitely want it between the ranges of 120 to less than 140. And the bottom number is the diastolic blood pressure, which typically we'd want it less than 90, so between 80 to 90. Why? Because high blood pressure gives you an increased risk of having strokes, of having heart attacks. So you don't want that high pressure in your body. It can also destroy other organs, such as your kidneys, such as your liver, that sort of thing. So if you check it on a periodic basis, they recommend every 2 years, you can be able to catch it before it becomes super high. I've had many people, maybe in their 30s or 40s, get admitted to the hospital because their blood pressures are in the high 200s. The top number is in the 200s. And they're always coming in complaining of chest pain, or they're complaining of the severe headache. And if they're complaining of chest pain, we're like, whoa, is the blood pressure so high that now it's caused a heart attack? Okay. But if they're complaining of like a headache, and us as physicians are like, should we get a scan of their head because they may have a head bleed or may have a stroke because of the high pressure that is now affecting their brain. So again, if you are starting to check it on a routine basis, you're able to nip it in the butt. If you have a family history of high blood pressure, you want to start checking your blood pressure. Okay. These are just measures that you want to check, just like how you check your weight on occasion. Okay. And if you haven't checked it once at age 18, doctors will definitely, for the most part, we check it every visit. So they say yearly screening should start at 40, but really we check it every single time you come to the hospital. Hospital and clinic, doesn't matter what age you are. And I think that that's appropriate. So the next thing you want to do is you want to inspect your skin at age 20. Start inspecting your skin routinely. So inspect it, just kind of look at it, see, is there any difference in colors? Is there any bumps? And even some people may say, oh well, I'm black. I mean, isn't skin cancer for white people? No. Skin cancer can happen with everybody. Okay. A famous person that had skin cancer and died of it is Bob Marley. And how did he get skin cancer? Well, he had exposure, as he was playing soccer and things of that nature. He had a melanoma, which is very common in Black people, melanoma in his lower legs. And that spread to the rest of his body. Apparently, part of the reason why it spread is because he found it too late and he did not want treatment. That is from what was documented. I don't know the true facts on that, but he did have melanoma. That's what I do know. Okay. So it's just a good idea. If you start seeing like areas in your hands or legs or even your back, it's itchy, maybe bleeding, different colors, raised up bumps, or it's growing, you definitely want to get it checked by a physician or a provider, so that if they have to, they'll just cut it right off before it spreads, because you don't want any skin cancer to spread. Also, by age 20, that's when you should start thinking about your cholesterol. Okay. So that's when cholesterol screenings can occur. And, why? It's kind of very similar to the whole idea with high blood pressure. Cholesterol, if you have too much of it in your system, can affect your heart. Okay. It can cause you to have a heart attack. It's like, just consider your heart. Okay. I'll try to do this analogy. So the way your heart is, it pumps blood in and out of itself, so that as the lungs infuse oxygen into the blood, this newly oxygenated blood can now spread to the rest of the body, and the oxygen and the blood that does not have oxygen can go back into the heart and go to the lungs, get filled up with oxygen, and go back out to the body. And it's just the circle thing that happens all the time. Well, the heart itself, outside the heart, it has arteries. Okay. And these arteries are kind of like little tiny pipes. Okay. These arteries around the heart is what gives the heart nutrients so that it can be able to pump. Those arteries outside the heart is what can sometimes get clogged. Just like a pipe can get clogged, those arteries can get clogged. And when those arteries at the around the heart gets clogged, that is when heart attacks occur. So if you have something that can clog those little tiny arteries around the heart, like cholesterol, and you have it in high concentration, of course you're going to have a higher risk of having a heart attack. So along with checking your blood pressure, just go ahead and just do a cholesterol screening. They say at age 20 is the best time to start, particularly for those who have history of either a family history of heart disease if they smoke, if they have diabetes, risk factors that already make you in a very high risk of already having heart disease, they want you to check your cholesterol so that that is not an added reason for you to have a heart attack. I hope I'm making sense with that. Otherwise, if you don't have risk factors for heart disease, they recommend starting at 45 as a man and 55 if you are a woman. Ideally, if you're going to do an annual exam, you might as well get your blood pressure checked, might as well get your cholesterol checked at any age, especially if you're overweight or obese. Just know your numbers. So as we get higher in age, then they start saying, okay, well, at age 35 for men, it's a good idea to start checking your blood sugar for what? Diabetes. And they said, check it, especially if you're overweight or if you're obese. Just go ahead and check it. And they also say every 3 years, you should go ahead and check it as well. Why do we want to check our blood sugar? A lot of times when people come into the hospital, and the reason why I know because I'm a hospital doctor, they come in with blood sugars in 600, 800, 500, 400, and they never knew that they had diabetes. By that time, they're coming in with symptoms of I'm thirsty all the time, I'm peeing all the time, I'm eating a lot. They may even come in with symptoms of blurry vision, and some may be hyperventilating because the high sugar concentration in their body has caused it where their body is now acidotic, and so they're hyperventilating to kind of breathe out that acid. Okay. If you can prevent yourself from going into those severe states of diabetes, why not? If you have a family history of diabetes, you know that there's a high chance that you could develop diabetes. So why not you check your numbers early on? And as I said earlier, I just attended a wellness conference that a lot of doctors, there was a lot of doctors there. And in that wellness conference, they said primarily, if you have diabetes and you recognize it at its early stages, you can be able to almost reverse it, meaning not having to be on, pills if you're type 2 diabetic. Type 1 is different, but I'm speaking primarily of type 2 diabetic. This is the diabetes that you find in the later stage of your adulthood. Type 1 diabetic is the one that you find when you are, you get diagnosed as a child. Now, I'm wanting to emphasize this. For type 1 diabetics, they likely were born with deficiency in insulin in their body. And so there's really not much you can do except for provide them insulin through injections. Okay, so that is a different type of diabetes. I'm talking about type 2 diabetes that has been rampant because of, unfortunately, the modern American diet, whereby there's a lot of sugar in the diet itself or carbohydrates. And now a lot of people are having this diabetes because their pancreas, which is in their body, and that's an organ that secretes insulin, has been overworked to the point where it's just like, I can't do this no more. And so it releases very minimum, if any, insulin. And so you have to take pills for it. Okay. Now, what I was trying to say is depending on the stage at which you get diagnosed. If you get diagnosed with diabetes early, you can just be able to control it with diet and exercise. And you may not even have to get on the pill. And that is a huge relief for a lot of people, because I see I see people in the hospital. It Once you get to the advanced diabetes, you start having symptoms of, and your diabetes is not controlled. You start having things such as, pins and needles sensation in your legs, or blurry vision. And then you can actually have a heart attack or a stroke, depending. And if it gets more severe and more severe, people have had their, toes amputated, or their whole foot amputated, or the whole leg amputated. They've gotten blind as a result of diabetes. So it's definitely not something that you want to have. And if you can control it and nip it in the butt sooner, the better it is for you. So that's why they recommend age 35 if you have any risk factors, or if which is obese or an overweight. But I just say, as early, just having a generalized screening and just checking for your blood sugar with your doctor is a good idea for anyone. Because they're even saying even younger children are getting type 2 diabetes at an earlier stage in their life. And so this obesity epidemic and overweight epidemic is starting to now cause problems. And it's definitely something I want to talk about and help us in, how do we prevent these chronic diseases from occurring? And so we'll talk more about that in later lives. So the next thing, at age 40, for Men's Health Awareness Month, that when you think of screening at age 40, it's a good idea to start thinking about, your prostate. Okay. We talked about our testicles for age 15, doing self-exams, making sure that there's no bumps or abnormalities or pain. But in age 40, it's a good idea to start saying, maybe I should check my prostate levels to make sure that they're not high. So what is prostate? What is PSA? PSA is prostate specific antigen. It's pretty much a protein that the prostate, which it's a small little organ at the base of your penis that you don't see, but it's internal. So it's a common area to have prostate cancer, and that's why we talk about prostate specific antigen. So if you have, sometimes when your PSA, which is the prostate marker, is high, it could be high for two reasons. It could be high either due to cancer, like we talked about, or it can be high due to your prostate being enlarged, which is another medical term we call benign prostate hypertrophy, BPH. But sometimes your doctor at age 40 may discuss, hey, why don't we check your levels just to make sure they're within normal limits? Especially if you have a family history of prostate cancer. This may be an idea to check. Again, if you do decide to check at age 40 with your doctor, you want to check it maybe every 2 years afterwards. And definitely if you have symptoms, pain in that area, or you're not voiding a lot, you go to the bathroom to pee and nothing really comes out, you definitely want your prostate levels checked. But that's probably the age at which you can probably start talking to your doctor about this. So again, for men health awareness, at age 50, you definitely want to have a colonoscopy, okay? And this is for someone who does not have a family history of colon cancer. For those who have a family history of colon cancer, you may want to check it early. And by talking to your doctor, they'll be able to decide the actual time that you should have that. But for everyone else, you want to check it at age 50, okay? And again, you're trying to screen for colon cancer. and things of that nature. If the procedure, and usually what that procedure entails, just in case people don't already know, is, they have this tube, and attached to the tube, there's a little camera. And, they will give you sedation, and they'll stick that tube down your anus, and it will go through all the areas of your colon, and it will look to see if there's any bumps, bleeding, abnormal bumps or bleeding, and that would show some sort of abnormality. If there's nothing there, then you're good for the next 10 years. But if there's something there, they may recommend you coming back to get that done in 5 years, in 3 years, or even 1 year. Okay. But it's a good idea to start thinking about getting that colonoscopy at age 50. Also at age 50, this is something that they don't really talk about. And it's really important, especially due to with diet, and due to the lack of diet, due to a lack of sunlight exposure, even exercise. There has been some predisposition to our bones being very fragile. Why? Because we may not be consuming enough vitamin C or vitamin D. Okay. Normally, when you think of osteoporosis, you think about it in the women, right? And the reason why is because as women go through menopause, their hormone systems tend to get imbalanced. And ironically, those sex hormones, which is estrogen and the progesterone, they do have an effect on bone building. Okay. So if the levels start going low because of menopause, that can also indirectly make your bones more fragile. So everybody always looks at the women and like, oh, well, it's the osteoporosis is mainly found in women. Sure, that's true. But with men, they also see osteoporosis there too. And unfortunately, it can be more fatal. And what does that mean? Well, if your bones are friable, you have a high risk of fractures. And we see time and time again people coming in after a fall. And if your bones are sturdy, that fall, you don't have any issues with. Hopefully you can stand up and go on your merry way. But with people who have fragile bones, a lot of times when they fall, one of the greatest impacts that they tend to get is the fall impacts on their hips, and they tend to get hip fractures. So it's almost every majority, at least once a week, if not more, I'm admitting somebody who fell and had a hip fracture. And unfortunately, with hip fractures, they tend to have a high risk of mortality, meaning that if the person does not go to proper rehab, does not start ambulating well, there's a higher chance of eventual death with hip fractures. So it's really important that even as we grow and get older, that we pay attention to our vitamin D intake, because that vitamin D helps to absorb the calcium that can be used to make your bones stronger, and also your calcium intake. Now, calcium, you can get calcium in, sorts of food, milk being the most common. Vitamin D is not so much. You need some of that. You can get, there are some vitamin D fortified food. I believe it's in some, they've put it in milk and other food. I think I saw it one time in orange juice, but I'm not quite sure. I have to look again. But definitely where you typically get the majority of your vitamin D is from the sun. And so it's important that we also have sunlight exposure. So I digress, but what I wanted to say is men can get osteoporosis too. And so at age 50, we definitely want to start doing what we call bone density scan. It's a scan of your hip and other areas of your body to see and make sure that your bones are strong, okay? And so they recommend age 50 to have it if you've had a fracture before, after age 50, because typically you shouldn't be having fractures from just a simple fall. But if you do after age 50, there must be some fragility of your bones. But if you haven't had a fracture, they recommend men after the age of 70 to have a bone density scan, and for women after the age of 65. And they recommend every 2 years having this. Okay. So and thank you so much. I appreciate it. Yes, it's very, very important. That's why I wanted to spend this time to talk about men's health, because we tend not to talk about men's health as much as we talk about women's health. And I know this is Black women empowerment, but we also have to talk about the men. And so hopefully, you men out there, you've gained something from this, and you women, at least you can tell your men, okay, hey, let's make sure that you're up to date when it comes to your health, because prevention is better than cure. I say this all the time. I'd rather prevent something or nip it in the butt in its early stages than have to deal with the consequences when it's already severe. I don't have time for that. So anyways, that is it actually when it comes to men's health and the screening test. Overall, if you can just get that, just going to your doctor and just getting a wellness checkup, once in a while, just to check your status, make sure you're good. And a lot of these diseases that we talked about, the high blood pressure, the cholesterol, the diabetes, especially in their early stages, can be maintained by diet and exercise alone. In this last conference, actually, there's this diet. It's called the Ornish diet. It's by a Dr. Ornish, who is a cardiologist. Who actually did residency under Dr. DeBakey here in Texas, the Texas Medical Center. And essentially, he had a group of patients who had severe heart disease. I mean, severe, to the point where they almost needed surgery, either a heart surgery or heart transplant. So that's how severe it was. He had them go on this specific vegan diet and check their numbers, check their heart condition afterwards. What he saw amazed him. It was to the point where it was some of those people who needed surgery. I mean, in order for you to need surgery, you would have to have a severe form of heart disease. Some of those people, just based on a vegan diet, just based on walking 150 minutes per week, or not walking, excuse me, moderate exercise 150 minutes per week, they were able to no longer need heart surgery. They were able to no longer need heart transplant. So we don't emphasize, and which we should, we don't emphasize the benefits of just diet and exercise. Eating more whole food, eating more plant-based. Yes, you can have you can have meat here and there, but it shouldn't be the emphasis. Exercising, moderate size exercise. We're not talking about, having to do, extensive weight training or something like that. We're just saying within a week, setting out 150 minutes, which is, what is that, 2 hours and some, with moderate exercise in combination with just a balanced diet. A lot of these conditions can be controlled. And in his case, he noticed that there was reversal of heart disease just based on diet alone. So that can happen with cholesterol, that can happen with high blood pressure, and that can happen with even diabetes. If not a reversal, at least it gets to a point where it's controlled by diet and exercise. So I thank you guys for this, time to talk to you. I do have some questions that I want to ask. Can you ever take too much vitamin C or vitamin D? So good question. Good question. We did do a talk about vitamin D earlier with David Dr. David Ajibade. And there are and so if you kind of scroll and look at the BWE platform, you'll see that talk, and we talk exclusively about vitamin D. But vitamin C and vitamin D are in two different classes. Okay, vitamin C is what we call a water soluble vitamin. So what does that mean? You can take a lot of vitamin C in, and the body only takes the amount that it needs and just has you pee it out. That's what a water soluble vitamin is. Whereas vitamin D is kind of different. If you take too much in, it's not going to be peed out. It's going to be stored in your fat cells. And so it's called a fat soluble vitamin. As a result, when it comes to those fat soluble vitamins, you kind of want to make sure you don't overdose. But as Dr. Ajibade said, vitamin D, he says that it's very rare that someone can overdose from it, but you still want to be careful. But vitamin C, even if you take a lot, the system takes whatever it can and just pees out the rest. Oh, hey, Aisha. Thank you so much from Oakland. I appreciate you too. I take sweet beets, vitamin C, vitamin G, chia seeds, and calcium daily. Can you ever take too much? Yeah. So again, I think at some point it would be a good idea to check your vitamin D levels just to see where you are at baseline. As I kind of said earlier, based on your vitamin D intake, can there ever be where you take too much? Yeah, there can. It's rare, but there is. But you just want to make sure by checking your vitamin D levels and making sure you haven't hit that boundary. I don't know of any liquid vitamins that help with that, but that's a very good question and also a very good topic. So I'm going to save that for the next for one of our future talks. We can talk about erectile dysfunction, talk about, so erectile dysfunction is very funny because there's different reasons why you can have it. You can have it from a psychological standpoint. You can also have it from a vascular standpoint. So if sometimes, or you can even have it from medication induced. So certain medications can cause erectile dysfunctions. So the first thing you want to do is just look at your medication list and see, hey, is there any side effects that they say erectile dysfunction? And if so, you might want to talk to your doctor about certain alternatives. But yeah, we can definitely talk about erectile dysfunction later on. You're welcome. Well, it looks like that's all the time we have. Oh, I'd like to see this. Michelle B said this, and so I'll end it with this. My husband was diagnosed with type. I bet she was dealing with diabetes. We reversed it with diet and supplements. He never knew until he was having issues with thirst and blurred vision. Oh, diabetes. See, so we have evidence that just with diet and I guess nutritional supplements, he was able to reverse it. And that's the power of diet and exercise. Well, with that, thank you guys for joining us. Until next time, bye.